Forum for Promoting Homeopathy is conducting regular webinars since last 1,251 days. And today we have a guest, one of our moderator and one of our a very good presenter and the person who has made so many presentations in International Forum for Promoting Homeopathy in different language, in Hindi as well as in English, is none other than Dr. Manish Singh Azad. And let me introduce him. As you all know that he is working as an assistant physician, Divine Homeopathic Clinic, Varanasi, and Divine is a renewed clinic, and it is existing last than from the last 33 years, and it's a great experience for him. He used to look after the patients in both online and offline during MD and COVID and after MD. Helped patients manage help patients management and OPD cases. Help in currently existing business process that improve productivity of minimum of 50 account. He has skill as a moderator at IFPH webinar, computer-based communication, OPD management, teaching, content creation, and medical blog writing. His achievements is that he has is the winner of. He has presented so many webinars in International Forum for Promoting Homeopathy in both in Hindi as well as in English sessions. Published 15 scholarly articles, and he has published 15 articles, well-known magazine in both English and Hindi. And this is on Kent repertory and Tinea corpus are one of the are some of the best from him. He has completed his internship thesis on Tinea corpus and MD thesis on Kent repertory with a significant sample size. Selected STSC research on breast cancer. His research on breast cancer and his miasm was selected for CCRH STSH program. Worked as a data collector for KB survey. Worked as a data collector on a knowledge, attitude of and behavior survey regarding lower urinary tract diseases in males. It was a significant experience for him. Managed full OPD alone. At many times when the doctor is unable to attend the clinic, he managed the whole clinic and compounded along with a good patient strength, and he has done very good presentation. He has regular lectures on repertory. And today he is talking about histrionic personality disorders and its homeopathic management. That is one of the best subjects we can talk here. So let us begin. Let us invite Dr. Manish Singh Azad for this wonderful evening to have a beautiful session. Welcome, Dr. Manish.
Thank you very much, sir. Sir, you have to make me the co-host for sharing the screen.
Yes, I shall make it because there was some delay in the beginning. I couldn't do that.
Yes, sir.
Yes, now you are the co-host and you can do it.
Thank you, sir. Is my screen visible?
Yes, everything visible.
Okay. Thank you, everyone. Firstly, I have to thank Sani sir for providing me this platform, and thank you, Dr. Dhanesh sir, for giving me another chance to speak on this platform. And this is my fourth webinar online today. Not today, it's fourth webinar in English on this platform. And the first one was on Cinderella syndrome, and the later the three ones was on personality disorder. This one is also on personality disorder. We have already talked about narcissistic personality disorder, antisocial personality disorder, and today we are talking about histrionic personality disorder and its homeopathic therapeutic. So let's begin. So if you look at this picture, can you spot which one among this picture just wants attention? You don't have to unmute yourself and answer the question. I just want every one of you to just notice the picture. There are 4 people sitting here, and 3 among them have a laptop in their hands, and the 4th one is only having a typewriter in its hand and is wearing a glass. The first one on your left, and he's the one in this picture who only wants attention towards him. This is what histrionic personality disorder looks like. So before talking about histrionic personality disorder, let's discuss what is a personality disorder. So personality disorder are a diverse group of disorders in which the common thing is a lifelong pattern of unusual behavior. Okay, so the behavior which looks unusual or which seems unusual is not from 4 days or not from 15 days or not from 2 months. It is a lifelong pattern of that unusual behavior. These disorders do not show bizarre symptoms like mania or schizophrenia. These disorders are observed in the way they cope life's problem and relate to others. Obviously, a behavioral symptom can be seen only on the basis of how you deal towards the environment or how you deal towards the external stimulus. So the way or the behavior towards which they are reacting towards the stimulus, that could be considered troublesome, or that may look strange or perhaps tiresome, and that what makes them into the that what puts them into the category of personality disorder. Okay, many people with personality disorders show lifelong adjustment or dysfunctional familiar history. So for understanding histrionic personality disorder, let's dive into each and everyone's mind. It's very normal to require attention from our loved ones and from our family, and to we all require appreciation at some times, that we look good, our physique is good, and we all have a desire to look attractive, and we all are emotional towards it. Okay, but if these reactions of wanting of desire to look much attractive, of having too much good physique, and or getting too much emotional is unusually increased for a very long time as a pattern, then this could be diagnosed as a personality disorder. So when we define personality disorder, it gets deviated, categorized. Okay, so in cluster B, there is dramatic personality disorders. Okay, we have already discussed in previous sessions narcissistic, that also comes under cluster B. We have discussed antisocial, that also comes under cluster B. And today we are discussing histrionic personality disorder. This also comes under cluster B, dramatic personality disorders. So the word histrionic means dramatic or theatrical. Okay, so the person who is suffering from personality disorder, his behavior would always be dramatic and theatrical. Okay, people with these disorders have intense, unstable emotions and distorted self-image. The people who are suffering from histrionic personality disorder, they will always have unstable emotion, and they have a distorted image of themselves. Okay, histrionic personality disorder is a psychological condition marked by prolonged pattern of constant attention-seeking behavior. Mark this thing, it's always the most important part of this personality disorder. Histrionic personality disorder, the most important thing is constant attention-seeking behavior. Okay, and it was different in narcissistic and antisocial. We will differentiate it later. It's exaggerated emotionality and an overwhelming desire to be noticed. A person suffering from histrionic personality disorder will always have an overwhelming desire to get noticed, and he will like to be noticed at each and every cost. It also includes sexually provocative behavior and theatrical behavior. Their self-esteem depends on approval of others and does not arise from a true feeling of self-worth, because these people suffering from histrionic personality disorder, they do not have a feeling of self-worth naturally. It always depends on the person who is sitting in front of them, who is emotionally more connected towards them, or the person from whom I want the attention. Okay, so my self-worth feeling would be dependent on the person who is sitting in front of me. They often behave dramatically or inappropriately to get attention. They can behave in any which way they want to get this kind of attention. Okay, so firstly we will go on the symptoms, and for this we have some images. So the signs of histrionic personality disorder, the first is attention-seeking behavior, as we have already read. Dramatic behavior, as we have read in the name of histrionic. inappropriately seductive behavior. Okay, so in this we have to understand that in histrionic personality disorder, sex or the physicality is always a tool, and this tool can any which way can be used in the favor of the person. Okay, so she or he can always behavior sexually provocatively, so he or she can get things done in his or her way. Okay, inconsistent emotions and mood, discomfort with lack of attention. If you do not give the attention to the person, then there is a discomfort which can be seriously seen in the person. Excessive focus on physical appearance. Since the person suffering from histrionic personality disorder is a very shallow person, you can always see that this person judges other person only on the basis of their physical appearance. If the person looks good, they will talk to them nicely, and if he do not dresses appropriately or he does not looks good, then they will not talk to him nicely. Constantly seeking reassurance or approval. They always seek reassurance or approval from the person who is sitting in front of them, or who comes under their friend circle. They are suggestible and easily influenced by others. They give suggestion in each and everything because all obviously they want attention, so they will jump into each and every dramas and each and everything if something is going around them. And they are very gullible. Okay, so they get easily influenced by others. Believing relationships are closer than they are. Okay, so they believe that if there is a friendship from 4 days or from a week, okay, so they will behave as if this friendship is from last 40 years or from last 10 years or something like that. Okay, so they will behave as if this friend is from so long, and he should behave in certain way to make him feel good. Okay, there is always a suicidal tendency if they will not get this attention. Okay, so in all these 10 symptoms, we get to know that attention is the most prior consideration of this patient, and if he's not getting this attention, then there is all this bizarre symptoms which are coming in the background. Again, dramatic or exaggerated emotions, as we have already read. Then there is seductive or provocative behavior, as we have already read. Then there is impressionistic and vague speech. The people who are suffering from histrionic personality disorder, the way of their talking is always impressionistic because they want the attention. So they will talk in a certain way to get this impression on you. Okay, there could be an accent or there could be a different way of speaking, which always makes them different from the crowd. And the way of speaking is always vague. They change this topic as per the person sitting in front of them or as per their friends crowd. Use appearance to draw attention by wearing bright color or revealing clothes. They always wear these kinds of clothes which draws attention. They always wear clothes such as which are very bright in color, or which always draws attention. Okay, if I give some famous example, then we all know Urfi Javed, then we all know Ranveer Singh, and they all wear these kinds of clothes that they make people look towards them. Okay, they are always gullible and they are easily influenced by others. As we have already read this, that they get easily into some other people's opinion, and they always started following it, that yeah, you are saying right, and yeah, you are right, because they always want attention. So they become gullible and they easily gets influenced by others. Constantly seek reassurance or approval, as we have already read, that they always want this kind of approval from others. Have rapid shifting and shallow emotions. As we were talking, that these kinds of person are always shallow. They always get on the person's appearance. Okay, so their emotions also shift like that. Their emotions shift from a very happy person to a very sad person, or from happiness to moroseness in a single minute also. And they have very shallow emotions. Next slide. So whenever we talk about dramatic or theatricality, this image comes into my mind. Okay, and this is a sense of theatrical, in which Kiran Kher is shouting nahi, and this is what histrionic personality disorder people normal routine looks like. Okay, their overt theatricalness can be resembled with this picture. Okay, then there is volatile nature of them. They since there is theatricality in their behavior, they get easily volatile. Okay, they are easily angered, and they are so gullible that they comes into other people's opinion, and then they behave volatilely, or they can behave angrily, that oh my god, you talked about me like this, and then a burst of anger comes in front of us. They are never considerate about others. If we see this image, there is a person sitting in between two people, and both the people are trying to work on in their office, and the person sitting in the mid is trying to talk on the phone, shouting loudly on the phone, and is eating a burger or something like that in mid. Okay, so this person is trying to talk, but is disturbing in some way to the people sitting around him and trying to work. Okay, so the person who is suffering from histrionic personality disorder, they always think or consider about themselves only. Okay, they are always inconsiderate about others. They are always demanding. Okay, they always crave attention. They know that what they need. Okay, they always know their needs, and they always demand that need, that you don't give me time, and you don't love me, or you love this certain person, and you do not have attention for me, and they demand for it. Okay, so their volatile nature comes as a behavior of demanding person. Okay, their behavior is always demanding, and they always want attention, and they always know what they need. Okay, they're always egocentric, since they want that all the attention comes towards them. Okay, so always there can be a envious or jealousy nature in the background. Okay, but the nature is always egocentric. They always think that the whole world's revolve around them. If Russia is fighting with Ukraine, then I, a normal guy, a normal homeopathic physician sitting in Varanasi, is thinking that since Ukraine has cancelled my visa, that is the main reason why Russia is bombing Ukraine, or why Ukraine is bombing Russia. Okay, so obviously I am not a prime minister of any place, but I can think in my mind that since I am such an egocentric person, or I am suffering from histrionic personality disorder, I am thinking that Russia is bombing Ukraine, or Ukraine is bombing Russia, because they have cancelled my visa. Okay, so this is the kind of thought process what histrionic personality disorder, people suffering from these, can seem or look like. Their emotion is always dependable on others. Okay, if a friend, or a boyfriend or girlfriend or a lover can message you in the morning and wishes you good morning, then you have a very good day. And if they do not wish you, if they do not call you in the morning, or they do not pick up your call, then you have a very gloomy and a very morose day. Okay, so their emotion is always dependable on others. What is the way you are talking to them, and what is the behavior you are displaying towards them, that always makes their talking, or that always makes their day. Okay, so each and every emotion of them are always dependable on others. So in this lines say that some souls are too deep for shallow people. Okay, since histrionic personality disorder people are always shallow, they don't care about emotions of other people. Okay, they always behave as per the looks. Okay, or as per the attention you are giving to them. Okay, they do not care that how you feel about certain situation, or about certain instances. Okay, they don't care about that. They only care that how much attention you can give towards them, or how do you look. Okay, what is your social status, and how can you help them. Okay, they only care about that, because they are egocentric. They only think about themselves only. So now, looking at this image, we know that this is uh, this is displaying overreactive behavior. Okay, so the person suffering from histrionic personality disorder, they always have a erratic behavior. Okay, erratic is some kind of behavior which is non-certainable. You can't certain that that this person will behave in a certain way. No, they can behave happily at some instance which should make them feel sad, but they can behave happily for that, and they can get angry for something which should make them feel happy. Okay, so their behavior is uncertain, and they can behave erratically at anything. Their behavior is always self-indulgent. Now there is a slight difference between self-indulgent behavior and self-loving behavior, or self-care. Okay, self-indulgent behavior always gives happiness for a few moments, and then you can feel sad about it. Okay, if someone says that they are a chocolate lover, then self-indulgent behavior shows that if they will eat lots of chocolate when they are sad, and then they'll think that now this will give me much and much calories, and I'll give fat. Okay, So that is a self-indulgent behavior. And self-loving behavior is what? If I'm getting angry of something and if I'm getting emotional of something, then I'll cry, and that will make me normalize. Okay. So that could be self-loving behavior. I'll console myself and I'll get happy in 5 minutes and I'll get into my routine. But self-indulgent behavior is what? If I'm getting sad, I'll eat a ton of pastry or hundreds of pastries, and I'll think of it and I'll be sad for 2 days, and then that is a self-indulgent behavior. Okay. So a person suffering from histrionic personality disorder will always be self-indulgent. And last is sexually provocative behavior. The person suffering from histrionic personality disorder will always wear dresses or will always talk in a certain way that could be sexually provocative, because as we have already talked about it, that sex or the physical appearance is always a tool. It is always a tool to get your things done in a certain way. Okay. So the behavior of a histrionic personality disorder would always be sexually provocative. Okay. So after looking at the signs and symptoms, let's come back to the epidemiology. That what could be the prevalence of histrionic personality disorder? When we talk about prevalence of histrionic personality disorder, the general population is about 2 to 3%. Okay. Now, in sitting in a room, we think that 2 to 3% is less. Okay. But when we think in the complex population, counting each and every one of them, then we understand that 2 to 3% is really a larger number. Okay. And since in India, it is a taboo to get diagnosed with a mental disease, then obviously people suffering from them don't get diagnosed and they don't accept that they are suffering from a mental disease. And that's a very different topic to talk about. Women are 4 times more likely to be diagnosed with histrionic personality disorder than men. This is a kind of disorder which mostly get diagnosed in women, 4 times more likely to get diagnosed in women than in considering to men. Okay. We already have talked about antisocial personality disorder, and in that case, it was vice versa. Men usually get diagnosed with antisocial personality disorder, and women do not. Traits to be noticed. What trait should be noticed if a person is suffering from histrionic personality disorder? People suffering from histrionic personality disorder display immature, self-centered, seductive, and attention-seeking behavior. Since we have already talked about that people suffering from histrionic personality disorder are attention-seeking persons, okay? They always want attention towards them. So they can behave in each and every way possible to get that attention towards them. They can behave immaturely, they can behave self-centered, they can behave seductively, but they want the attention towards them. They can manipulate people, but they want that what is their desire should be completed. Okay. They are manipulative and they make others do their bidding by indirect tactics. So planning and plotting is always behind the camera, but it is done in their life. They make others feel guilty for their awful suffering, and they always blame others for any unwanted change in their life. If anything is changing in their life, then it's always your fault. Okay. It's never theirs fault. They are usually flamboyant with exaggerated expression of emotions. Okay. So let me give you an example. If a girl is going on a road and she gets a splinter in her legs, in her feet. Okay. Then it's your fault that why you haven't cleaned the street, or why you haven't carried her in your hands. And it's always your fault why that splinter is not removed till yet, and why you haven't consoled her yet, or why you haven't booked the Ola or Uber for her. Okay. So it's always your fault. Okay. And the behavior, okay, the behavior which she'll display for that splinter would be, oh my God, now I won't walk for a month, and now this will get a septic, and I would have to get my leg amputated. And that would be an exaggerated expression, and that what comes under histrionic personality disorder. They always show tremendous need for attention from others. They always want attention towards them, and they can do anything, each and everything, to want that attention. They want to be center of attraction, and they will do almost anything to attain this goal, often dressing in unusual ways or using physical beauty or sex appeal to attract attention. So, as we have already read, the dresses or the physical beauty or sexual appeal is always a tool to get the attention. So in this line, we are reading that on the surface, this person show confidence and seems socially skilled, but inside they're lacking the confidence and have powerful needs for acceptance and approval for others. Okay. This may seem like narcissistic personality disorder. In narcissistic personality disorder also, it was that person lack confidence and have powerful needs for acceptance and approval. Okay. And they also want the confidence from others. Their mask was also of confident person, of flamboyant person, and inside they were also lacks confidence, and they always have the powerful need for acceptance. This was also the case of narcissistic personality disorder, but there is a big difference in them. Okay. They are in histrionic personality disorder, the people are self-centered and rarely show concern for others, thus having difficulty in maintaining relationships. People of histrionic personality disorder have always a difficulty in maintaining relationships because these people are shallow. They don't know how to behave emotionally towards other. Okay, so they can never get attained for a long time in a single relationship because they don't know how to behave. Okay, so if in future, if after few slides we'll talk about the psychological analysis, and when we will we will school them that how you should behave if someone gifts you, how you should behave if someone compliments you. Okay, so this kind of person who is suffering from histrionic personality disorder, they always have a difficulty in maintaining relationships. A person with this disorder might also shift emotion rapidly or act very dramatically, as though performing before an audience with exaggerated emotions and expressions, yet appears to lack sincerity and depth of the thought. Okay, so the people who are suffering from histrionic personality disorder, if they are walking out of a door and the hinge got on their feet by an accident. Okay, so they'll behave in a certain way that, oh my god, my feet got stuck in the elevator, or my feet got stuck in the door and now I can't walk, and now I want a plaster, please call a doctor, please call an ambulance, and please dial 911, and I can't walk, and oh my god, what will I do? Okay, so the kind of behavior which a person will display would be exaggerated emotion. They usually have a low tolerance for frustration, and they easily get bored by a routine. Okay, so now if I'm talking, if I'm explaining something and it's been half an hour already, and if I'm talking about histrionic personality disorder, and if I'm suffering from histrionic personality disorder, then I get bored and I'm sitting and, oh my god, why am I talking, and oh my god, I don't want to talk, and let's close this topic, and it's very boring. So the person suffering from histrionic personality disorder always have a low tolerance. Okay, they get easily bored. They often begin a project very happily, very hastily, and they always skip that event, that, oh my god, I can't do this, and they skip from one event to another. They do not think before acting, and they always make rash decisions. Okay, they always end up making rash decisions, and this can even threaten, they for the sake of attention, they can even threaten or attempt suicide. Okay, they can behave that, oh my god, I'm going to jump from this balcony if you do not give attention to me. This certain friend is not talking to me, and if you will not talk to me, I'm going to jump from this balcony. Okay, if India do not gives me a Nobel Prize for homeopathic contribution, I'm going to jump from my balcony. This is what a certain way a histrionic personality disorder will behave. Okay, so after understanding the symptoms, let's go on the cause. What could be the cause a person is behaving in this certain way? Okay, as we have already read in narcissistic personality disorder and antisocial personality disorder, that there is no pinpoint cause of any personality disorder. Okay, there are many theories and there are many reasons which are given, and obviously we are going to discuss that. The first reason is histrionic personality disorder tends to run in families. Okay, so some consideration that there could be genetic susceptibility associated with some families. Okay, so if a mother is suffering from personality disorder, histrionic personality disorder, then there are much chances that if a daughter comes in that family, then she might suffer with histrionic personality disorder. Having a family history of personality disorder, a psychiatric illness, or a substance use disorder is always a risk factor for histrionic personality disorder. If in any family substance use disorder is going on, or any psychiatric illness is already going on, or as we have already read, a histrionic personality disorder mother or father is present, then obviously the offspring can be diagnosed with histrionic personality disorder in future. Studies have shown that there is a strong correlation between functions of neurotransmitter and the cluster B personality disorders. Obviously, histrionic personality disorder is a type of cluster B personality disorder, and the studies have shown that there is a strong correlation between functions of neurotransmitter. Okay. Cluster B personality disorder, there are antisocial personality disorder, narcissistic personality disorder, histrionic personality disorder, and schizoid personality disorder. In all the four of them, we can see that the person have highly responsive noradrenergic system. Okay, we have read in first year physiology that there is a adrenergic system and noradrenergic system. Okay, so the response of noradrenergic system is always high in cluster B personality disorders. Okay, and this is responsible for synthesis, storage, and release of the neurotransmitter, which is known as norepinephrine. Okay, so this noradrenergic system is highly responsive, and this can lead to release of norepinephrine as a higher pace, or synthesis or storage of norepinephrine at a higher pace. Okay, so if you want to know that what can norepinephrine do, then I can give you an example that they can feel pain at a much higher level than you. Okay, if this norepinephrine gets more secreted, then there could be an instance that a person can feel too much pain for a single stucking the leg in the lift example, for too much pain, literally feeling that in comparison with a normal person. Okay, that could be an example for it. Other reasons for a person suffering from histrionic personality disorder, the parenting style. Okay, the parenting style may also influence the likelihood of developing a histrionic personality disorder. What parenting style a parent was behaving with the childhood or the offspring always makes a mental picture of the person. Okay, the psychoanalytic theory believes that the authoritarian or distant attitude by one, mainly the mother or both parent, along with the conditional love based on expectations the child can never fully meet. Let me explain this to you. The psychoanalytic theory basically believes that if you are an over pampering father or a mother, okay, if you are an over pampering guardian, then that also can lead to histrionic personality disorder. Or you are a guardian who always behave nicely socially, okay, but not in a personal space. Okay, so again, let me give you an example. If you are pursuing the fees and you are taking the books and you are taking school, but when the instance come for a board game, you already avoid it. If the instance come and the child asks that let's play cricket, dad, and you say no, I can't, I don't have the time. And if the girl comes and says that mom, let's cook food together, and you say no, you always cook disastrously. Okay, so this can traumatize them, and they may behave or they may feel that our expectations are not met by our mother or our father, so let's behave, or this can behave as a trauma for their mental state. Okay, histrionic personality disorder may develop as a result of trauma experienced during childhood. Okay, so this trauma is like an accident. Okay, this is not that trauma that psychoanalytic theory believes in. Using psychoanalysis, Freud believed that lustfulness was a projection of patients' lack of ability to love unconditionally and develop cognitively to maturity, and that such patients were overall emotionally shallow. So basically, Freud believed that since they lack maturity and they lack groundedness, so obviously they'll behave exploitatively, or they behave lustfully to match that love. Obviously, because they are shallow and they can't display that love, so they will behave lustfully to match that. Okay, match that real emotion. He believed the reason for being unable to love could have resulted from a traumatic experience, such as death of close relative during childhood or divorce of one parent, which gave the wrong impression of committed relationship. Obviously, if they have seen already that people get divorced, or one person die in a relationship and the other person have to suffer for a longer time, then obviously they will think that no love gets a happy ending. Obviously, so why should I believe in love? I'll always behave that other people are my minions and I can get them make my bidding. Okay. Exposure to one or multiple traumatic experiences of a close friend or a family member's leaving would make the person unable to form true and affectionate attachment towards other people. And if the person suffering from histrionic personality disorder has seen in his childhood that his neighbors do not have a close bonding with his family, or there is a trauma attached to the neighbor or the close one, then obviously that will affect this person affection, obviously to express themselves emotionally. Okay. So after looking at the traits and the causes, now let's come on the topic that how we will evaluate if a person is suffering from histrionic personality disorder. Okay. So there is this DSM-5, Diagnostic and Statistic Manual of Mental Disorder, 5th edition. This says that there are 8 points, and if a person completes more than 5 points, then he is suffering from histrionic personality disorder. This DSM-5 consists of 8 symptoms. These 8 symptoms are uncomfortable when not the center of attraction. Obviously, if there is no attention for histrionic personality disorder, they will get uncomfortable. Seductive or provocative behavior, as we have already talked. Shifting and shallow emotions. Uses appearance to draw attention. Impressionistic and vague speech. Dramatic or exaggerated emotions. Easily influenced by others. And considers relationship more intimate than they are. We have already read these symptoms. And if the person is if you are ticking the boxes and a person gets ticked more than 5 symptoms, okay, 5 or more than 5 symptoms, then you can diagnose the person for histrionic personality disorder. And if you see this kind of behavior for a longer term, then obviously that person can be diagnosed for histrionic personality disorder. Okay. Then there is a criteria for WHO. The World Health Organization do not believe in DSM-5, and it's believe in ICD-10. Now, ICD-10 is a bunch of 10 symptoms, okay? And if the person is satisfying these 10 symptoms or more than 5 symptoms, then obviously you can diagnose him or her for histrionic personality disorder. Now, these 10 symptoms are shallow and labile affectivity. Obviously, gets affected from the crowd, obviously, okay? So, shallow and labile affectivity. Self-dramatization, theatricality, exaggerated expression of emotion. Suggestibility means gullible, obviously. Egocentric, self-indulgent behavior, lack of consideration for others, easily hurt feelings, and continuous seeking for appreciation, excitement, and attention. Okay. So these 10 symptoms are present in ICD-10 list. And if a person ticks boxes more than 5, then you can diagnose him or her for histrionic personality disorder. Now comes to the general management. Okay. So the gold standard for treating personality disorder is always psychotherapy, because there is no FDA approved medication for the treatment of histrionic personality disorder. Okay. There is no FDA approved medicine specifically for histrionic personality disorder written as, if a person is suffering from histrionic personality disorder, then give XYZ. Okay. There is no such medicine. Okay. The gold standard is always psychotherapy. You have to teach the person, or you have to school the person that how you should behave. Okay. So what could be the medicines? Obviously, if the person is suffering from depression, you have to give antidepressant. If he's suffering from mood swings, then you have to give mood stabilizers and antipsychotic drugs. Okay. So the treatment is always as per the symptoms. What are the symptoms? And give the medicine as per the symptoms. This is the general management. Now let's come to the homeopathic management. So homeopathic management, you always do require a proper constitutional treatment, but always you have to give the psychological counseling too. Okay. So Dr. Navneet Bidani, he's a famous doctor. And since I have quoted Dr. Navneet Bidani here, that is why I have mentioned his name also. He's saying that since many people who have histrionic personality disorder will emphasize on attractiveness in their lives and relationships, discussing alternatives and trying out new behavior may be helpful. Okay. So always you have to make the people try out new behavior. Okay. They often manipulate others through emotional crisis, using charm, sex, seductiveness, or complaining. Okay. People with histrionic personality disorder often need to be shown how the short-term gains derived from this interactional style result in long-term cost. And they need to be taught more appropriate ways of negotiating their wants and needs. Okay. So what Dr. Navneet is saying here, that you have to try and school each and every basic thing to a person. Okay. If he has to behave in a certain way, then you have to school him to behave in a certain way. Okay. what I was talking earlier, that if someone is gifting you something, then you have to say thank you, and you have to feel that thank you inside your heart. If someone is complimenting you that you look beautiful, then you have to say thank you in return. And what you should do, you have to, when you counsel the person, you have to tell him that you should say thank you if someone compliments you. Okay, they are not your minions, and it's not necessary that they should give a compliment. So if they are complimenting you, then you should say thank you in return. Homeopathy works on individual and holistic approach, obviously. Below mentioned medicines. So I have mentioned 5 medicines, and these five medicines basically ticks all the symptoms of histrionic personality disorder. Okay, I have quoted these 5 medicines from Rajan Shankaran's book of Soul of Remedies. Okay, so that is why I have mentioned here that these medicines and rubrics are quoted from Soul of Remedies of Dr. Rajan Shankaran for better insight of patient. So the first medicine which comes is Tarantula hispanica. Okay. Obviously, if we know Tarantula hispanica, we always know that Tarantula's behavior is always on the basis of attention. Okay. So as per Dr. Rajan Shankaran's Soul of Remedies, Tarantula is the feeling of unreciprocated love and affection. Okay. Tarantula always feels that there is unreciprocated love and unreciprocated affection. The person has the feeling that he is not attractive enough, and therefore does not get the attention he craves for. Since obviously histrionic personality disorder, the person is suffering, the person is always wanting attention, and he feels inside that he is not getting the attention he's craving for. This is why this medicine contains many features related to attraction, as for example, wearing tacky clothes, singing hysterically, and dancing weirdly or wildly. Tarantula can also be mischievous, cunning, hysterical, lascivious, shameless, exposing himself, or even threatening, all with the intention to attract attention. So as we have already read in histrionic personality disorder, that people behave in certain way. So these are all the symptoms as behaving mischievously, cunningly, hysterically, lasciviously, because you always want attention towards you. There are some rubrics mentioned in Soul of Remedies. Colors charmed by blue, green, or red. Obviously, these are vibrant colors. So that is why I mentioned here. Dancing wild, deceitful, and activity fruitless. So if we read all of these characteristics of Tarantula hispanica, we can match it with the symptoms of histrionic personality disorder, and can be given to a patient if this medicine suits as a constitutional medicine to him. The next is phosphorus. Obviously, if we are talking about narcissistic personality disorder, pulsatilla should always come in mind. Okay. So if we are talking about histrionic personality disorder, phosphorus should always come in mind, because phosphorus person are always an attention seeker. The behavior of a phosphorus is always drawn as per the attention of people. Okay. Phosphorus feels that he's not getting enough attention and feels secure only when amongst a lot of friends, receiving a lot of attention and a lot of love. Okay. So phosphorus only feels comfortable if he is getting the attention. If he is not getting the attention, obviously he'll not feel happy, and he'll always desire more and more attention. He'll crave more and more attention. Phosphorus tends to attract attention towards themselves, either by their appearance, the manner of their speaking, or warmth they show. Okay. The main feeling of phosphorus is of being unloved and uncared for, to which patients react by being affectionate, by being friendly and sympathetic, in the hope that his love and care will be reciprocated. So the total behavior of phosphorus, behaving sympathetically or behaving caringly or behaving affectionately, is always derived from the want or need of attention. He may have lots of friends, but is often unable to make close or intimate friends, as we have already read in histrionic also, that the person can't make a close friend. Okay. So in phosphorus also we are reading that there is there can be a lot of friends, but is often unable to make close or intimate friends, and most of his relationships are at quite superficial level. Making relation and feeling emotion at superficial level and attention seeking behavior are some of the prominent symptoms of our personality disorder too. Obviously, it's a matching symptom. If we see few rubrics, there is delusion, she is alone in the world, affectionate and returns affection, amativeness, attention want of, and clairvoyance. The next medicine is Paris quadrifolia. So Paris, if we want to understand Paris, the Paris in this medicine, the person is the only situation, is the only child in the family. Okay, and everybody else in the whole family is the adult. Okay, so that the mindset of this child is the adults around me always talk strangely, and I can't understand what they talk to me. Okay, all of his basic amenities and demands are fulfilled, but they lack in quality time, and thus he feels isolated. When we talked about the cause of histrionic personality disorder, the Freud analysis theory, we already talked about this, that if the child feels isolated, then it can lead to histrionic personality disorder. And here in this Paris quadrifolia, the child is the only child in the family, and the rest of all are adults, and they are behaving obviously as an adult towards him. So he is unable to understand what they want. Okay, they are giving the fees, and they are giving the bags, and they're giving the toys, but they do not want to spend the quality time with the child, and obviously he feels isolated. So in order to rescue from this situation, he is attracting attention and love of people around him by behaving foolishly. Okay, by behaving in a silly way. So he is behaving as a joker, or he's the rubric comes jesting. Okay, he speaks in a foolish, funny, ludicrous, and in an egoistic way. Obviously, all these ways are just a way to attract attention. Okay, and love towards him, which he clearly lacks in the family around, because he feels that the family around him do not loves him. So he wants this attention, and for this attention he can behave foolishly, he can behave funnily, and he can behave in an egoistic way. The rubrics could be cheerful and foolish, childish behavior, frivolous, gossiping, haughty, loquacity, cheerful, and exuberant. Next is palladium. The main feeling of palladium, obviously palladium was in narcissistic personality disorder too. If someone was if someone was attending that webinar, he or she might be remembering that. The main feeling of palladium is that he is not getting that good opinion of others about himself. People do not care about him, and he's always neglected, and he's always forsaken. And because he's not getting that attention he's craving, so he will behave in a certain way, obviously, to get that attention. Their self-esteem, obviously palladium self-esteem depends on the approval of others and does not arise from a true feeling of self-worth. Obviously this line was in this slide too. Okay, thus this patient behaves nicely, tries to look nicely in order to get a good opinion about himself. Okay, so the behavior of palladium always depends on the people who are talking to him. That is why this medicine is mentioned in few rubrics as flattery desires, delusion she is not appreciated, delusion neglected he is, and offended easily. So if we look on these symptoms, we can match histrionic personality disorder with palladium. The last medicine of the day would be hyoscyamus niger. If we talk about hyoscyamus niger, in hyoscyamus there is a tremendous fear of being alone. Okay, and facing danger of outside world all alone. So the person has a fear that he will be alone, and he will have to face the danger of any world only alone. Okay, only if no one will be on his side. Okay, so he behaves foolishly, he behaves ridiculously or insanely just to attract attention and provoke laughter. So the kind of behavior which hyoscyamus displays towards the people is always to get this attention. Okay, is always to provoke laughter towards him. One of the main features of hyoscyamus is the feeling of being sexually unattractive. The patient of a hyoscyamus, as per Soul of Remedies, feels that they are sexually unattractive. Okay, so the reaction, obviously, we know that hyoscyamus behaves shamelessly and openly featuring the sexual, provocative, and lewd behavior. So the Soul of Remedies says that this reaction is towards that feeling, because of that feeling, that he has a feeling inside that he is unattractive. Okay, these patients can be loud, excited, animated, and with an over-the-top sexual behavior. So this can accompany with lewd talks and displaying genitals. Now, if we talk about the rubrics, that could be foolish behavior, lascivious, lustful, lewdness, shamelessness, exposes the person, nymphomania, singing obscene songs, laughing loudly, jesting, ridiculous, or foolish. Now, if we look at these rubrics and the symptoms, we can tick the boxes for histrionic personality disorder. Now, the conclusion. Since we have already seen the symptoms and the causes and the epidemiology and the signs and symptoms and what we can do and what homeopathy can do, now the conclusion. Histrionic personality disorder was first studied by Dr. Sigmund Freud, okay? And the roots can be traced to the cases of hysterical neurosis. Basically, Sigmund Freud described histrionic personality disorder as hysterical neurosis, okay? And in psychoanalytical theory, he divided this into two parts. The first was hysterical neurosis, and the second one was hysterical character. This hysterical character was histrionic personality disorder. Basically, this webinar was an attempt to make understand that personality disorders are not as acute and alarming as mania or other mental diseases. Patient feels it through a long time, and then they refer a physician for its distressing symptoms. We also conclude that psychological reassurance and psychological therapy is much required in these cases with correct and judicial use of constitutional medicines. Homeopathic medicines, since chosen on individual and constitutional grounds, can always be helpful for these kinds of disorder. And this was all for the day. So thank you very much. If there is any question, please, you can go for it.
Yes, Dr. Manish, it's really an excellent session, but nobody thought that this is usually people get this kind of patients, but none of us were able to diagnose the case as this histrionic disorder. Frankly, this kind of presentation really make us more better personalities to diagnose such mental conditions also, even though homeopathic doctors get such cases and we used to treat the patients, and sometimes we get very good improvements, but unfortunately we were not able to diagnose the case, and that is the beauty of your presentation. Each and every presentation made by you in this forum are entirely different from usually people made in this forum. All the cases, all the presentation made by you are really connected to mind and psychiatric disorders. So
Yes, sir.
that's a very, this is something that everyone need to look into, because we as homeopaths are supposed to treat the patient, not the disease, with the mental, giving specific importance or particular importance to the mind symptoms. So
Yes, sir.
mind is the man, or mind is the person that comes to you, and if you are able to explore the man in the patient, then definitely you will be the winner. And so all the medicines you've shown here are really very good. Some of the rare remedies also you have shown. So we will definitely study those rare remedies in such a way so that we can get a beautiful cure from patients. And of course, your knowledge in this area are really excellent. And congratulations for such a wonderful session once again, Dr. Manish. And it is
Thank you very much, sir. Thank you.
It is over to Dr. Ram Parishas to say some your opinion as well as your question. You can ask your question, and those who want to have a chat with the Dr. Manish can raise your hand so that we will allow you to unmute yourself and speak. So get ready for the question and answer session. I hope all of you will participate in this beautiful evening in this discussion. It's over to Ram Paresh, sir. Please unmute, sir. Please unmute.
Thank you, Dr. Dhanesh ji and Dr. Manish ji. Very, very thanks, Dr. Manish ji. Histrionic personality disorder. Really excellent session.
Thank you, sir.
Dynamic lecture. Dynamic lecture. Very, very thanks. Main cause of disease, according to law of homeopathic science, mind. Mental symptom is a very important first grade of symptom. Very nice, excellent session. According to Adhyatma, सुनहु तात मानस रोगा, जिनते दुख पा वही सब लोगा। विषय मनोरथ दुर्गम नाना, ते सब नाम सुनको जाना। ममता दादू कंडू हर साई, हरस विषाद ग्रह बहुताई। काम काम बात कफ लोभ पारा, क्रोध चित निच्छाती जा रहा। तो माइंड सिम्टम इज द इंपॉर्टेंट सिम्टम, और माइंड सिम्टम टिट ओनली होम्योपैथिक मेडिसिन curative way of treatment, not other kinds, only palliative way of treatment. Thank you, very, very thanks, Manish ji.
Thank you, sir.
Excellent session. Thank you.
Yes, and that's a good compliment. And now it's up to Dr. Hibbert to say something on the presentation.
Sorry, I am not well. Today I just only entered.
Okay, okay, no problem. If anybody want to have a chat, I think Dr. Harihan sir, or is there anyone want to speak about this kind of presentation? Please write one another person in fix hots 9 play, but his audio is not connected. Dr. Jarish. Harihan sir, do you want to speak, have a discussion? Please unmute, sir. Anyway, we want this sort of presentation in the coming days also. And as the time is about to finish and already finished, hope you can present some of beautiful cases or such disorders in this presentation, so that everyone can understand what is what in psychological disorders. Particularly, your effort in making such presentation are really great, and on behalf of International Forum of Promoting Homeopathy, as well as on behalf of myself and those who present here, we are very thankful to you for an excellent evening in this 1252nd day here. So tomorrow we will have a session from Dr. Rudrakshi Dev, and she will be talking about homeopathy management of abortion. So with that, we come to the end of the day. Thank you all for your excellent participation once again.